sure that you can. Oh, goodness. So let's see. I don't think that you can see me. So I am going to remove this fixture here. So give me 1 second. Yeah, there I am. Yay. Hey guys, it's Dr. Dawn, Chicago's On Board Certified OBGYN. I am here on my Facebook Live page and on Instagram. So you'll see me kind of looking at both of these videos because it's weird talking to two cameras at once. But thank you all for joining me. I am here usually every Thursday at 12:30. And I am usually picking a topic that has been given to me by friends and family. I got a lot of people that kind of hit me up on my text message, or they'll call me, or even they'll hit me up on Messenger, and they'll just have questions, which is cool because that way I can usually talk to them and then I'll bring it to you guys. Hey Val, thanks for joining. Black Millionaires, thanks for joining. So again, Dr. Dawn, Chicago's On Board Certified OBGYN. My mission is to empower women with pertinent medical information and proactive reproductive health knowledge so you can foster and improve your physical and mental health. I think that we do better when we know better, we do better. And so my goal is to kind of pick topics that women come to me and want to know more about so that you have some information that you can work with. So one of the things I wanted to talk about this week was ovarian cysts. Again, this came out of a friend of mine. She called me, she was working with some things. And so talked to her a couple of times about it. So I figured this would be a good topic for us to discuss just in general, one-on-one with you guys. So we'll start from what are cysts and where do they come from. And I printed up a nice little, I had a nice little picture of the internal organs, because I really think it begins with knowing and having knowledge about your body. So what I have here, and I'll just do it from my book. I have this, The Cover Girl Life. It's called Teen Guide to Positive Body Image and Self-Confidence. This is my book I wrote in 2017. Basically a guide for young girls. We talk about everything from the menstrual cycle to STDs to feeling confident, all those things. So in the first chapter, what I have is a picture of your internal organs. I have a picture of the outside and inside. So that's the internal organs. I'll put it here. You can see that you have your uterus and you have your fallopian tubes, and then you have your ovaries that are sitting back there. So I tell ladies that the uterus is usually about the size of a pear. OBGYNs, we like to compare things to food because that helps us to know the sizes of everything. So your uterus itself is, I tell people, is usually about the size of your hand, a fist, maybe a pear. And again, that's without having anything like not being pregnant, not having fibroids or adenomyosis. Those things will cause the uterus to be kind of bigger. But with a normal size uterus, it's going to be the size of your fist, size of a pear. And so the ovaries typically are kind of sitting on the side there of your uterus. They are right at the end of your fallopian tubes. And I'd say they are the size of usually a pecan. Hey, Coach Kiana, thanks for joining. The ovaries are the size of a pecan or a walnut. That's the best kind of thought process to know the size of it. And of course, my little dog, he's not little, he's big, but he is crying to get outside. Hopefully he will not continue to interrupt me. So size of an ovary, even a grape. You can have a grape, you can have a walnut, you can have a pecan. So they're not very big. So when they're enlarged, even by just a centimeter, you can feel that. And that's when women are like, oh, I got some pain, because let's say it's just a couple of centimeters and then it's larger and you only have so much that's in your pelvic cavity, you sometimes will get symptoms with that. I tell ladies, if you've grown up and you played with your favorite guy friend and you got anywhere near their testicles, They kind of back up. Whoa, wait, hold up. Can't mess around with that area. Their testicles are very sensitive. Like they are very much overcome with pain if you do anything close to harming them. And but your ovaries are similar. So the ovaries are the female testicles. So they're both sex organs. When you're born, you start as this undefined embryo, and then you either have female hormones or you have male hormones. If female hormones come, then you develop into a woman. If there are no female hormones there, then you stay a guy. And so the ovaries and the testicles are pretty much the same thing, except ours are internal. But the sensitivity is very much the same. So that's why ladies that have cysts can sometimes be really sensitive to them. So if we see that the ovaries are not that big, let's say they're, hey, Kelly, thanks for joining. If they're about the size of a pecan or a walnut, that's not that big. So when you have cysts, they don't have to be that big to be symptomatic. So let's talk about some of the symptoms that you may notice if you have cysts in your ovaries, and then we'll get on to what that cyst could potentially mean. So some of the main reasons people come in to see me is because they're having pain. They're having pain in that lower quadrant there, lower side, right or left. And it could be dull, it could be achy. Every once in a while, it'll be really severe. It like will double them over and then run into the ER. A lot of times that happens when women have a cyst that has ruptured. So if you have a ruptured cyst, then that could be extremely painful. But just having a regular simple cyst, you can have pain from that. You can feel bloated. You may have more inclination to go to the restroom. So you may go to the restroom a lot. Again, if we look at my picture of the uterus, what you can't see is what's in front of the uterus. So you have your uterus there, but what's sitting in front of it is your bladder. So your uterus here, your bladder is there. So anything that's enlarging that uterus can impact your bladder. Your bladder is this thin-skinned dome that collects the urine. But if your ovary is sitting right next to your uterus and it's enlarged, it can impinge on that bladder at times. So it just depends on how large that ovary gets. So you can have bloating, you can have frequency. Every once in a while, that ovary will torse, which means that it is kind of almost like a string. So on that string, it's kind of dangling. And then if it turns on its axis, in the string that holds that ovary close to the uterus, we have vessels. So when those vessels are twisted, then the blood supply to the ovary is also decreased. So you can have pain with that. That's called a torged ovary. A lot of times we'll see that in our ladies that start with a cyst in the ovary, and that ovary flips on itself. So those are some of the symptoms you may have. It may not be severe, it just might be ongoing. So a lot of times you go into the doctor's office and we will do a pelvic exam. We'll evaluate you. Pelvic exam will be putting that speculum in so we can take a look at your cervix. But then the main thing is to do it by manual. So you'll have a finger in the vagina, we'll have something on the top, hand on the top, and we'll just palpate it. Typically with a normal exam, we shouldn't feel the ovaries because like I said, they're pretty tiny. So we're palpating, we can feel that uterus. We put our hands right under your cervix. We can push that uterus up a little bit and really kind of push down to know the size, the general size of it. And then if your ovaries are enlarged, we may palpate it, but more importantly, during the exam, you're gonna have pain. So I will do my exam. I'll put my hand on the right versus the left, and you'll say, oh yeah, doc, that's it. That's the pain I'm getting. And then if I push deep enough without causing a lot of pain, I may feel it. And then I can say, oh yeah, your ovaries enlarged. Now, let me just say right now, having a cyst is not necessarily a bad thing. We know that we ovulate. Let's see if that picture came up. I really had my little pictures to be ready for you guys. So I'll just use my book again. So when we ovulate, every month you are releasing an egg or ovum from the ovary, right? You release that egg from the follicle. The follicle itself is what the egg is housed in. You have estrogen and progesterone that's in the body that helps to mature that egg that's in the follicle. You have a lot of different follicles that are all acting at the same time to get the mature egg. So you may have 5 follicles kind of in a race to get that egg ready, but only one will make it. So that egg is released from the follicle, and the egg is released into the fallopian tube and travels into through the uterus. But then you have all these follicles that have been preparing and just didn't make it. So the area that has been developing can form a cyst, and it can be a simple cyst. When we say simple, that means it's thin-walled, it may have fluid in it, but that's really about it. And usually with the cyst, your body will normally resorb that fluid that's in the cyst, and kind of the cyst will go away on its own. So at any given time, we may do an ultrasound and you'll have a cyst in your ovary that we'll see. That's Apollo. You'll have a cyst in your ovary that we will see, and we'll just follow it. You know, depending on what your symptoms are, how severe your pain is, we may follow it, not necessarily intervene with surgery. When I say kind of follow it, you usually with a simple cyst, you can just use Tylenol or use ibuprofen, and that will help with the pain. Typically, it's associated to a certain time in your menstrual cycle. So you'll ovulate, and then you may have some pain there. The cysts develop. So it usually correlates to your menstrual cycle when you're getting these cysts. Every once in a while, that cyst is not resorbed and it gets larger. It can be 2 to 3 centimeters. Now, I am saying centimeters. I'm not saying inches. So a centimeter is probably about this big. And so 2 to 3 centimeters is still a fair amount, but it's not inches. So you've got to pay attention to that. Now, some of the cysts that may occur that we will look into are called complex cysts. And usually that means that there's more inside that cyst than just fluid, straw-colored fluid. You may have blood, you may have an endometrioma. So we call that a chocolate cyst, because a lot of the ladies that have endometriosis, they will also note that there's some blood on the ovary inside that cyst, and that can enlarge and that can cause pain, because blood itself can be an irritant, especially inside your pelvic cavity. So if you have a endometrioma, which means you have a cyst that's filled with blood, that could be painful. Especially, we usually find that women have more pain when these cysts hit about 3 centimeters, 3 to 4 centimeters. That's when we start to see that they cause pain. Again, typically when we see these cysts, they're associated with your menstrual cycle. Every once in a while, you may have a cyst that's not necessarily associated with your menstrual cycle. One cyst that could be complex is kind of associated with the menstrual cycle, but it's mostly associated with pregnancy as a corpus luteal cyst. So what happens is that ovum that is released from the follicle that's still in the ovary, if that ovum meets with sperm and it's fertilized and you have a baby, then that corpus luteum then produces a hormone, progesterone, to help maintain the pregnancy. So that's a cyst that we normally see in the early pregnancy, and that's very common. That's part of what happens. So corpus luteal cyst is something that we see when women are pregnant. You can also have a fecal luteal cyst. Kind of similar. It really responds to very high levels of beta HCG, the pregnancy hormone. And sometimes we will see that with ladies that are doing treatments for infertility, because we give them high doses of those hormones. And so you can have a cyst kind of as a result of the tissue that's there responding to those high levels. Again, that's something we watch. We monitor the size, we monitor your symptoms, and we're trying to just be sure that symptomatically you're okay without us necessarily having to do surgery. So we have simple versus complex, and sometimes the complex can be other structures that are involved. So one of the main things we'll see with complex cysts is what's called a dermoid cyst. This type of cyst is not necessarily dependent or responsive to the hormones in your menstrual cycle. This cyst is really created from abnormal cells that are created from the origin of the cells that are in your ovary. So any cell that's in your body, it's going to start as a stem cell, then it's going to be three different types of cells. In a dermoid cell, each of those types of cells are located in the ovary. So it's very interesting when you look at a dermoid cyst, because inside a dermoid cyst, you may have teeth, you may have hair, you may have mucus, you may have blood, because that is the result of this cyst having all of the origins of cells inside of it. So it's really kind of weird because let's say this cyst is getting very big, woman is having a lot of problems, and we look and we do a laparoscope and we say, oh, this looks like a dermoid. Depending on how the size of it, we may take it out and find that it's a dermoid cyst. So one of the questions that we have, or my ladies will have, is, hey, is this cancerous? Do I need to be worried about ovarian cancer? Most times, no. And I say most times, no, because most times our cysts are simple. So if it's a simple cyst, 9 times out of 10, it's going to be resorbed and it's going to go away, and you're not going to have a problem. What we do have to look at is the complex cyst. So the complex cyst, we can look on the ultrasound and see that that's not just fluid, that's something else. There is either blood or mucus or something that's there. We may follow that for a little bit. We want to monitor the size. If we see that the size is kind of progressively getting larger and larger and larger, then we may do what's called a laparoscope. And with the laparoscope, we'll go in. It's not an open surgery. You just have a surgery, a couple of small incisions on your abdomen. We use a trocar to go in, it has a camera in it, and then we can look inside your belly, look at that ovary really up close, and decide whether we want to do a biopsy, whether we want to take that one cyst out, or whether we need to take that whole ovary out. And again, depending on the size, depending on how it looks, if it looks like it's something that we need to make sure it's not cancerous, we'll take that ovary out and we will send it to pathology to make sure that it's not cancerous. So if you have a complex cyst, 5 to 10% of those may be cancerous. So if you have a complex cyst, we've watched it for a little bit, it's either progressing inside, it's a large size, then we may decide to take that ovary out and send it to pathology to make sure that it's not cancerous. Of those complex cysts, 5 to 10% that we take for surgery, you can have up to 20% of the 10% that could be cancerous. Now, again, this depends on the age of the woman when she presents. So you have a higher chance of something being cancerous at either extremes of your age. So if you're postmenopausal and you have an ovarian mass and you see a cyst or that whole ovary is enlarged, then we want to really look into that because that has a higher chance of it being cancerous. If you are a young girl, let's say you're 5 to 6, or you're in puberty, 11, so you're a younger age and you have a mass, those tend to also can be cancerous. So if you're someone that's premenopausal, really in childbearing age, and you have a cyst, even if it's complex, it's not as high of a chance of it being cancerous as the women that are at extremes of age. So I am going to look, let's see, right now, I don't see that I have any questions. So let's see. We have any questions? Do you have any questions? Just drop them in the chat, and hopefully I'll be able to see it and be able to let you know about those questions. Let's see. Dr. Goldie, how are you? Thank you for joining. So that's kind of the overly simplified what I have for the cyst. I have my list. We have simple, we have complex. The cysts that are simple typically will be a small in size, clear fluid. We'll do our exam, we'll do our ultrasound and take a look. Plus or minus whether we'll have to do something like an MRI to kind of get a better idea of what the tissue makeup is of the cyst if it's complex. 5 to 10% of the complex can be potentially cancerous, and of those that go to surgery, up to 5 to 20% will be cancerous. Again, dependent on the age of the woman when she's presenting, as to whether that truly is the case. So that is it for our cyst. Again, look out for your symptoms, look out for that pain. If it's a ruptured cyst, it's going to be sudden onset, very severe. But then once it ruptures, it's really not a problem. After that, we really will treat you with pain management. We will look at the ultrasound and see if it's an endometrioma, see if it's a dermoid, different type of cysts that are out there. But in general, most women have simple cysts, and most of us will have them. If you did an ultrasound of a group of women, I'd say probably 80% will have a cyst, and a lot of them won't even know that they have that cyst because it's asymptomatic. So that is it for today. I hope you guys learned something. Definitely want to keep following me here. I am on Instagram and I am on Facebook. Dr. Dawn OBGYN. That's how I am on all modalities. I'm on YouTube. I am on Twitter. And something to keep in mind is this weekend I'm starting my 5-day mini course. I am doing a 5-day mini course for moms that want to gain information about their teen daughters. So on the first day, I'm going to talk about your what the anatomy is in detail. Second day, we're going to talk about the menstrual cycle. The rest of the days, we're going to talk about what puberty is. We're going to talk about what is healthy self-esteem and how we foster a positive body image. So that's the 5 days that we're going to do it. Probably like 30 minutes a day. We're going to meet at 6 o'clock. So if you are interested in joining me on that, you will just go to drdawnobgyn.com/clever girl 5-day. So I thought I had put that up there. Let's see. I'll put that on there now. Yes, we're going to put that on because, like I said, I am going to do that challenge starting on Sunday. It's going to be every day, so Sunday through Thursday, and it's going to be about 30 minutes. We're going to start at 6 o'clock, and let's see. That's what I'll be doing just so we can get a better idea and help our girls learn more about their body. So I figure I'll talk to you guys, and you can share that information with your daughters, or you can bring them on board with us while we're on together. So let's see. Yeah, I think that went up. Yes, it went up. drdawnobgyn.com/clever girl 5-day. That is a 5-day challenge where I'll be doing lessons. I will have a small lesson sheet for you guys every day. So if you sign up, you get the lesson sheet so we can go through it together during the course and after course. We'll be doing that. Hey, Dr. Constance, thanks for joining. So definitely pay attention to that. Make sure you're checking out my website because I have a lot of blogs and I have a lot of information there talking about contraception and things like that. And also, if you're interested, you still can pick up this book, Clever Girl Life. A lot of the information that I talk about with my Facebook Lives, they are actually in the book. We discuss it at some point because I really have a passion for helping our teen girls. So I am going to sign off for now. Thank you all for joining me. I had a blast. And be sure to meet me again next week. Next Thursday, 12:30 p.m. I will be back here. I will be on Instagram. I will be on Facebook, my Dr. Dawn OBGYN page. And if you have a specific topic that you're interested in, let me know. Give me a message and I will talk about that then. All right, guys. I'll talk to you.